We have a lot to celebrate tomorrow. Father's Day, the first day of summer, and a full week of the daily COVID cases below 100. Here to share the good news is Dr. Emily Hyam, the infectious disease specialist at Mass General Hospital. Good morning.
Good morning.
Well, vaccinations are down, vaccinations are up, and infections are down. Are you seeing fewer COVID patients at MGH too?
We are, and it's really exciting. Among our outpatient tests, many fewer are negative, and the hospitalizations are down as well. So that's really exciting news for us.
Absolutely. We've talked about this a lot, the danger of the new Delta variant, but so far it doesn't appear to be having any impact on our numbers. Is the threat over, or is there anxiety? Like, are you bracing for something?
It's a really good question. I think we're learning more and more about what the Delta variant means. What we found so far is that people who are vaccinated are protected against the Delta variant, and that's really good news. Where we're seeing the most concerning issues are among people who remain unvaccinated or who are partially vaccinated. So I think it's a really good time, if you're partially vaccinated, having only had one dose of the vaccine, to go ahead and really make the time for that second dose, because of course full immunity doesn't happen until 2 weeks after that second dose. And if you're not vaccinated, to talk with somebody about how to get vaccinated, and to think about what those concerns might be, to have them addressed, and to get access to vaccination.
A lot of people are planning to spend time with Dad this weekend. What's the risk of getting together right now if most people in the group are vaccinated, but maybe one or two are not? Should they still wear masks?
So the CDC recommends that people who are fully vaccinated, again, 2 weeks after that second dose, are very protected and don't need to wear masks either indoors or outdoors when gathering with people outside their household. For people who are unvaccinated, we do recommend that they continue to wear masks so that they can remain protected themselves. I would emphasize that for people who are immunocompromised, meaning on immunomodulators or chemotherapies or organ recipient transplants, that despite vaccination, which we do recommend for these people, that they do continue to wear masks, because we're just not sure of their level of protection after vaccination.
Okay, this might be seen as a little touchy subject, but do you think people should ask their friends or family whether they're vaccinated before they make the plans? And is that something you do?
It's a good question. I really believe in these vaccines. I think they are safe and effective. So I do actually often offer that I'm vaccinated when talking with somebody, to open up that conversation around why they may or may not have chosen to be vaccinated, so that I can talk with them about what their concerns are or what the barriers have been for them to be vaccinated, to try to figure out a plan forward.
Okay, you can always say, well, my doctor told me I really should ask. Thank you, Dr. Emily Hyam, an infectious disease specialist at Mass General Hospital. Thanks for joining us.
Thanks so much.